This is a CNA podcast.
Picture the scene. A daycare center for the elderly in Hong Kong, with staff tending to their charges. A man in his 70s ambles along with his cane. He's come to pick up his wife. She suffers from dementia, rarely speaks, and is wheelchair-bound. She needs help with everything, from eating to going to the bathroom. She spends about 7 hours a day at the center. The other 17 hours, she relies solely on her husband. To get her home, he has to lay out a ramp to push the wheelchair up the final flight of stairs and into their modest apartment. You'd be right to think that the physical burden this places on him is high. But there's more. As couples age, they not only struggle with physical care, but the burden on their mental health increases too, especially for the primary caregiver. What more during a pandemic? I'm Steve Lai, and on this episode of CNA Correspondent, you'll hear a story that is becoming more and more recognizable across Asia, as demographics increasingly skew older. But back to our doting husband. His name is Poon Sam Win. He is 73, and he has serious health concerns of his own. So serious, they've had a negative impact on his mental health.
I was diagnosed with late-stage prostate cancer just as my wife's situation turned serious. I was so worried that I couldn't take care of her anymore, so I thought of committing suicide with her. Later, I realized that I couldn't decide for her because she's unable to express herself.
Wow, that really puts for better or for worse in sickness and in health into perspective, doesn't it? And for more perspective on Mr. Poon and mental health among the elderly in Hong Kong, I'm joined by my colleague Deborah Wong, who worked on the story with her team. Good to speak to you, Deborah.
Good to see you, Steve.
Yeah, there's a lot to unpack with this story, but I want to start with what sat me back in my chair as I heard it. Mr. Poon contemplating ending not just his life, but his wife's too. Tell us more about this couple and their situation.
So the couple, they've been married for about 50 years, but the last 10 years have been pretty difficult. Mrs. Poon has dementia, and Mr. Poon discovered 5 years ago that he has prostate cancer in the late stage. So he doesn't quite know how long he has left to live. And since he is the sole caregiver, he's worried that nobody knows how to take care of her like he does. And he kept this secret really close to his chest, but decided against going through the plan of taking their lives because Mrs. Poon is at the stage where she can't express herself, her wishes or her desires. So Mr. Poon said, and he acknowledged that it was unfair for him to decide on her behalf. But don't let this undermine his dedication to her, because the couple, they live in Kwai Chung. Now, that's a residential estate in Kowloon, and it's a pretty old residential estate. So the buildings, we're seeing it completely devoid of any sort of universal design. And what this means is that there are little flight of stairs leading to houses, and for people who are wheelchair bound, it can get a little inaccessible. So what Mr. Poon did is to build this wooden ramp from scratch, and it took a couple of trial and errors. Eventually, he decided to lay down some rubber strips, and it was supportive enough to wheel his wife in and out of the house. And the fact that he did that, it really showed how committed he is to caring for her.
And quite a physical effort it must take for him to get her to and from the care center as well and look after her for so many hours of the day. He is her primary caregiver, is that right?
Yes, absolutely.
And it must be quite exhausting then. Is there no one else that can help?
Well, Mr. Poon actually has 3 children, but the thing is, he told us that taking care of her is his responsibility. So he doesn't want to burden his children. His children are working, they have their families of their own, so he sees this as his own responsibility.
Did he talk about his own mental health and how he's coping with all of this? It's a lot to look after someone in the situation that his wife is in, but then to also be contending with his own issues.
Yeah, for sure. So we approached this interview with the intention of finding out the kind of stresses that caregivers go through. And we found out that a huge part of the stress is because they simply do not have time for themselves, time to chill, time to just breathe, time to walk around. So, for instance, Mr. Poon said that before his wife's condition worsened, he was spending about 80 hours a week caring for her. This includes bathing her, feeding her, making sure that she's okay. And this is physically exhausting also because, remember, he has prostate cancer. Walking is a little bit difficult for him. He walks around with a walking stick. And as a caregiver, lifting a loved one from the wheelchair to the bed, transferring her from one place to the other, it takes a huge amount of effort because the entire body weight of that person is on you. And these patients, more often than not, they are 4-risk patients. So you need to be very sturdy on your own 2 feet. And this, I think, takes a huge amount of mental pressure as well as physical pressure. So definitely that strain is there.
Next on CNA, you'll hear how Mr. Poon and his wife's story is an increasingly common one in Hong Kong as its population ages, and how its old-age residential homes are struggling to cope.
Hi, I'm Stephen Chia, and I host the new season of our podcast, Heart of the Matter. Join me in getting right to the heart of the headlines as we speak with experts and newsmakers to delve deep into the most talked about news developments. Look out for our episodes wherever you get your podcasts.
Some of our services have already reached maximum capacity. There's a waiting list for our service and we have to hire more staff. But as you know, we are encountering some difficulties. The first thing is immigration. We are doing many outreach programs to get young people to experience working in social welfare services.
That's Maggie Siu. She's in charge of integrated elderly services at Baptist Wee Kwan Social Service, and she's touched on a key challenge that is only going to grow as populations age. In Singapore, for example, its annual population report released this week projects that by 2030, around 1 in 4 citizens will be aged 65 and above. And as we're increasingly becoming aware, their mental health as well as their physical health will need to be considered and cared for. You're back with me, Steve Lai, and Deborah Wong. And Deborah, I want to expand our discussion to talk more about mental health. One indicator that paints a bleak picture of Hong Kong senior citizens is that its elderly suicide rate hit a record high last year of 446. Now, that figure alone accounts for 44% of the city's overall suicide cases. Those are startling numbers, but would I be right to say that the pandemic has been a contributing factor here?
Well, I mean, it is a huge factor. So let's break down the figures a little bit. NGOs like the Suicide Prevention Services, they run a 24-hour hotline. And just the first half of this year alone, it tracked nearly 70,000 calls for help. And when we look at that figure, it's actually a 21% increase from the same time last year. So a huge factor given that the fifth wave of COVID-19 really held Hong Kong hostage during that time period. And when we look at the COVID-19 restrictions that Hong Kong is facing, it has been incredibly isolating. We saw almost daily lockdowns in housing estates, and in fact, where Mr. Poon and Mrs. Poon live at Kwai Chung, it was a huge mess back in February, March, April. There were daily lockdowns happening in that district. And there was also the dining ban. It started from 6 p.m. So after 6 p.m., people could only take away food. They can't dine in. But even before 6 p.m. hit, people were just queuing up to take away their lunches, their breakfast. Nobody dared to venture out to sit down, have a meal with their friends or family. So there's this running narrative of fear that it was the end of the road if you contracted COVID. And because at that time, hospitals were full. Newspapers, news channels, you switch on the TV, you see people lying in hospital beds outside the hospitals. They were wrapped up in thermal blankets. So there really was a lot of fear going around. I remember back when it was in February, I was there to do a report. I was standing outside one of the hospitals and it was below 10 degrees Celsius. You know, I was shivering and I was in 2 jackets. Can you imagine people who are sick and bundled up in thermal blankets sitting outside in the cold? It was quite a terrible situation to be in. So, you know, that fear, that delay in getting acute care, bodies were piling up in morgues and all that, it was a very sad sight. And that's why people did not want to go out. And that contributed to the rising sense of isolation. And that eventually also pushed people to just
to the brink.
Stay at home. Exactly. Pushed them over the edge. And because there was so much focus on acute care, services like counseling, services like community help, all these were scaled down in capacity. People weren't getting the help they needed. So it's little wonder why they are pushed over the edge.
Well, now then that the pandemic is in retreat and Hong Kong is opening back up, are there signs that things will improve for seniors?
Well, things have gotten slightly better after the fifth wave. So earlier this year, many of the government-run daycare centres as well as residential homes, they scaled down the capacity. That's why the private-run centres, they had to pick up the demand. But now that the COVID situation has improved slightly, these centres are slowly resuming the normal operations. So there's better access to such respite services for sure. But the situation is a little harder still for residential care homes because these care homes, they experience a lot of fatal outbreaks during the fifth wave, and families now are thinking twice about registering their loved ones there. And also there are restrictions still for people who want to visit their loved ones in these care homes. And because you can't go in freely, you can't say, look, I want to visit my dad today. I can just pop by after work, after gym. You can't do that. You need to take tests. You need to apply. There is a quota. So it's incredibly difficult for families to want to take care of their loved ones in a care home. So people are staying away. And unless the social distancing rules ease further, the take-up rate for these social services, they will still remain quite low.
And let's come back then to mental health. And what are Hong Kong authorities and health services doing to address the mental health of seniors, given the challenges that they are facing as they age?
So the fundamental problem here we're looking at is isolation. And if people can't access the centres or they don't want to or can't leave the house, home visits are really the next best thing. So we're seeing a spike of demand for home visit services. That's where Baptist Oi Kwan Social Service, and that's a social service that Mr. Poon is engaged in. They do conduct regular visits to homes. And also during the pandemic, the fifth wave was quite isolating for the couple. Mr. Poon, he actually got in touch with the social service, and what they did was to arrange remote video conferences, calls and all that, just to make sure that he's not alone. He said that he was going through art therapy. There were classes where he could actually interact with other caregivers. And I think that whole sense of isolation has sort of been minimized a little bit. So that's where authorities are working on. They are conducting outreach programs. They're trying to reach out to seniors who are at home alone to just let them know, hey, look, if you need some help, if you need someone to talk to, we're here for you.
Okay. An NGO survey shows that 60% of caregivers in Hong Kong are above the age of 61. So it's perhaps a little surprised there's a surge in demand for respite care. Is that available? And how sustainable is it?
Well, unfortunately, it's not very sustainable at the moment. We spoke to a respite care provider as well as a member of Hong Kong's Elderly Commission, and they both said that there is a serious shortage of manpower. And across the board, at daycare centres, at residential care homes, and I'll tell you why, because COVID is a huge issue in Hong Kong right now. And 20% of the care workers, they have been redeployed to places like vaccination centres and even community isolation facilities. So that is one part of the problem. The other part of the problem is that Hong Kong is experiencing right now an exodus of residents. People are tired that there's no end to border restrictions before the latest announcement broke that it's going to ease quarantine measures. There is still uncertainty as to the direction the city is going in, especially after the 2019 political turmoil. So because of that, a lot of people have upped and left. And manpower is low, so such services, they really cannot meet the demand for care that we're seeing at the moment. And all these places, the NGOs are calling for help. They're trying to engage the government to get more financial support to cover the cost of operations. They're also suggesting incentives to draw younger people to the industry. So NGOs are also doing their own outreach programs to try to get more people excited about helping out.
Yeah, hopefully that will get some traction. This is a story that will hit close to home for many of us. We all have parents that are aging, and we ourselves will also be looking ahead to what's going to become of us as we age as well. What's your biggest takeaway that you've learned while you've been working on this story?
You know, people always say that it takes a village to raise a child, but this story showed me that it also takes a village to care for someone. Early on in his caregiving journey, Mr. Poon was adamant that he didn't need help at all. But now that he's sending his wife to the daycare center, you know, it gives him some free time to go have some dim sum, go have some beers with his friends. It's so important in the long run to care for yourself, because when you do that, then you have the capacity to take care of others.
Thank you, Deborah, and your team for all the good work you put into for this story.
Thank you, Steve.
This episode is part of CNA's wider coverage on the issue of mental health, as we mark World Mental Health Day on Monday, the 10th of October. If you'd like to know more, then head over to cna.asia or download our mobile app. I hope this episode has brought home to you the importance of mental health, especially as we age. But can we do it with dignity and on our own terms? And can we make it comfortable for our loved ones as their bodies surrender to time? Perhaps that's a topic for another episode. For now, keep your loved ones close, and I'll leave the last word to Mr. Poon. Thank you for listening.
If you want to stay beside your loved ones longer, you must learn how to let go and rest. You've got to be strong before taking care of the others.